About 2 weeks ago, or about a week ago, we were dealing with COVID-19 in about 1 in 10 schools and early learning services across the country. We're now up to 1 in 5, and we expect that number's going to continue to grow. So we are taking steps to try and make sure we're providing as much protection as possible in education environments. In our schools, we've got over 40 million face masks being distributed over the next few months to make sure that our teachers have access to a fresh supply of masks whenever they need it. They'll be the medical grade masks that people are now getting used to wearing, and we do expect our teachers to be wearing those masks. Students will still need to wear face coverings for those above year 4 and above. But they can be the fabric cloth face coverings that they can bring from home, and that can be reused. But we will be supplying schools with a backup supply for students as well, so that when students lose them, or they get broken, or they forget them, the schools will have a backup supply of masks that they can use for young people. We've managed to source some smaller size medical grade masks for primary age students, and we'll be distributing those to schools as well. We've also got portable air cleaners coming. The first of them are in the country. CO2 monitors have been distributed to all schools so that they can keep an eye on the air quality within their learning spaces and make sure that they're, certainly in summer, ventilating them as well as possible. And then as we head towards winter, we'll have those air cleaners available where natural ventilation isn't as useful or isn't as effective. And we've got rapid antigen tests now, over 700,000 of those distributed through the Ministry of Education's regional network. So they are available in the event that schools need those in order to ensure that they're sufficiently staffed to be able to support students. The main message there, though, is if teachers have a household contact who's got COVID-19, in the first instance, we don't want them coming to school, even if they're getting negative rapid antigen tests. We want them staying home, reducing the risk to themselves and to the students who they work with. It would only be an absolute last resort if we had no one else who could go into the school to look after kids who had nowhere else to go, that we would look to use that test to return scheme that we're using in other workplaces, other essential workplaces. As the supply of rapid antigen tests increased, we may be able to have greater use of rapid antigen tests in the coming weeks in education settings. But at this point, our focus is on making sure that we're supplying those tests for people who have symptoms, who are household contacts of people who have COVID-19, or who have to return to work because they are an essential worker and there's no one else who can do the job. So that's really the priority over the next week or two. As supply increases, we'll be able to look at whether we can broaden that out a bit. And then finally, of course, as we indicated yesterday, we are looking to change the paperwork. In fact, that should have been changed in the last sort of 24 hours or so to allow for retail sales of rapid antigen tests. So that's pretty much there or thereabouts. And so it will be up to the retailers now to source rapid antigen tests and then make them available for public sale for other reasons. Happy to open up for questions.
Can you speak to why teachers are being encouraged to stay home if they have the RAT test in the morning and say they're a close contact, that test is negative, why are they being encouraged to stay home and not return?
Rapid antigen tests are no guarantee. So some rapid antigen tests, some of the studies would suggest some of those rapid antigen tests can be missing 1 in 5 cases. So we would only put someone in a school environment with that level of risk if we absolutely had to. In most cases, schools will be able to manage through using relief teachers, through adjusting timetables and so on, to make sure that they don't have to be there. And that helps to reduce the risk of significant spread of COVID-19 in an education environment.
You said you could be a bit more generous with rapid antigen tests in the coming week, especially with the likes of schools. Were you too slow in ordering the RAT test?
No, we started ordering rapid antigen tests late last year, around November, December. We're trying to get hold as many as we could. The reality, though, is that there has been an international run on rapid antigen tests, and I think everybody's been struggling to get them. We have managed to source quite a lot of them, over 100 million that we're expecting, that we've got really good firm orders in for, probably even more than that. I think it's about 180 million that we're trying to get yet, so that we've got orders in for, we haven't necessarily got confirmed delivery dates. We know that in the next 2 weeks, the number of deliveries of rapid antigen tests into New Zealand really starts to ramp up. And at that point, once we've got those stocks in place, we may have the ability to extend the use of them. But it's important to note that at the moment our priority has to be people who have COVID-19 and who have people in their household who have it, people who are showing symptoms. We've got to make sure that they can get the tests as quickly as possible. So they've got to be our priority in the first instance.
Will rat tests be
So we know we never intended, and when we put out the guidance, our expectation was that all of the activities that would happen in a school environment would continue to happen, that kids wouldn't be excluded if they weren't vaccinated. But the way that's been interpreted, some schools are interpreting something like a kapa haka rehearsal after school hours or a sports practice after school hours as being included in the guidance. We'd never intended for that to be the case, so we're clarifying that. So to make it clear that if you're participating in a school organised activity that includes sports, kapa haka, those other cultural events, then the vaccine pass, the vaccine requirement will not apply. So any students participating in those activities where the school has organised it, they will be treated as if they are vaccinated even if they're not, because we never want students to be excluded from schooling activities on the basis of their vaccination status. And we were really clear about that from the beginning. So what we're doing is just clarifying those rules to make that really crystal clear, so that where there has been confusion and where the rules have been interpreted in a way that we never intended, that won't happen anymore.
Will you look at offering rapid
antigen? For schools only, not for club sports or for college sport, for example, organisations. You're only going to deal with school.
That's right. So it is school organised activity. Club sport and so on is treated under the framework the same as for any other age group.
Will rapid antigen tests? Will rapid?
Look, and I acknowledge that, and clubs will make their own decisions about whether or not they're offering an unvaccinated option for those young people who won't have been vaccinated. They can do that now, so clubs can offer club sport to those who haven't been vaccinated. They obviously have to comply with different rules when they're doing that. That's ultimately over to the clubs. One of the things that we have had back from club sport and so on is that there's a degree of hesitancy around having unvaccinated people involved in those activities, and that they're worried that some other people won't participate if they think that there's a higher degree of unvaccinated people involved. So we're trying to get the balance right here. The key thing for us is making sure that education isn't disrupted at all by someone's vaccination status.
Will rapid antigen tests? Will rapid?
Well, you may as well finish. Yeah.
Sorry, I really want to make sure we know the school sports thing. So far, it's going to why not go further until that it's ended sports through clubs and make that also equal cups of why not ensure that clubs actually work as well?
Yeah, look, the main issue here right now is that we want to make sure that students can participate fully in their schooling and in the life that goes with being at school. So that's what we're trying to do. As the Prime Minister set out, though, a few weeks back, it was last week, I think it was. The days all blur into one at the moment. But as the Prime Minister set out just recently, we do expect to be in a position where we'll be able to ease some of the vaccination requirements once we get through this next peak of the Omicron outbreak. And then things like club sports heading into winter may well find that they're subject to less disruption than they might be expecting at the moment.
Will rapid antigen tests be available to secondary students? If you look over at Europe, students attending school there, secondary students attending school there, could do a rapid antigen test and then go to school knowing that they don't have COVID. Would that be an option for secondary students?
I wouldn't rule that out, and I've never ruled that out. We're not in a position to do that right now, but it remains an option that we'll be able to keep on the table, and if it's justified and if the supplies allow for it, I certainly wouldn't rule that out.
Why can't
you, as further that more and more teachers are isolated and that's actually available to teach? We've got obviously the lead teachers, not enough to really cope with this.
Where a school is disproportionately affected by COVID-19 cases, either amongst teachers or amongst students, and normally there'll be an interrelationship between those two things, we will be supporting schools to do more remote learning from home, so either rostering students from home or even, in the worst cases, closing for on-site learning for short periods of time where that's justified, and we'll be working with them to support that as much as we can so that students can continue to learn. Obviously, our approach now is different to what it was when we had our level 3 and our level 4 restrictions in place, and that we do want students and teachers on site as much as possible. But there may well be instances where that just doesn't become feasible, and so we need to be able to support schools through that, and we'll absolutely do that. So we've got funding available through Ministry of Education regional offices to support schools to deliver online learning, to put together hard packs of materials that students can take home. There is additional support available where that's needed, but it isn't going to be right the way across the country. It is going to be much more targeted based on where there are particular outbreaks that justify that.
Why can't
Sorry,
Yeah.
when you've got unvaccinated students participating in school events, like school events, what about the parents who aren't vaccinated?
Parents will still be subject to the same rules that they are now. So where it's directly a school-related activity where they're participating, there are fewer vaccination requirements because we don't want parents to be excluded from being able to ensure their students, their young people can participate. But where it is a sort of an outside of school activity, then those same vaccination requirements will apply for them.
Why can't teenagers get their booster shot?
We've received advice from our technical advisory group on a regular basis. They continue to review all of the science around that. At the moment, they haven't recommended booster shots being made available to the under 18s, but it is something that they continue to look at. They also continue to look at the gap between, there's currently an 8-week gap between doses for very young people, for their 5 to 11-year-olds. They've looked closely at that again just in the last week, and they've recommended at this point that not be changed. So I'd refer you back to the Director General's comments yesterday in our press conference where he talked about their reasoning for that. But I think it is likely that we may see further advice around boosters as the evidence base there grows, particularly for the 12 to 18-year-olds. But we haven't had advice to recommend that at this point. But we're ready to move and ready to make those available as soon as we get that advice. So we're following the science here. We are taking a cautious approach. We don't want to increase risk. And so when the technical experts come back to us and say extend the boosters to that age cohort, then we're ready to do that.
But in the meantime, confident that just the 2 shots is enough to protect secondary students attending school.
Yeah, and I'd refer you to the Dr. Bloomfield's comments yesterday where he went through the difference that the primary course, the first 2 doses, makes to the spread of Omicron, and also the difference that the booster makes. Now, we know that the booster makes a huge difference in terms of reducing hospitalisation, and that's sort of more serious illness. And our booster rates are quite high already in the most at-risk cohort, which is our elderly population. So that gives us a really good start in our fight against Omicron. For younger people, the evidence base there is still emerging, and so we'll continue to follow that really closely.
Minister, you say that you want RATs to be a last resort on one hand because you say it's about protecting children start, but then you say in a few weeks there's no change. Can you confirm if this is a development welcome business of our country being put first to education?
No, not at all. We've got to make sure that people can still go to the supermarket and buy their groceries. We've got to make sure that the lights can stay on. We've got to make sure that roads and public transport can continue to operate, even when we're dealing with potentially what could be quite a large peak of COVID-19 cases, because everybody's welfare depends on that. And so that is the priority, that first and foremost priority for our testing, our exemption scheme to make sure that people who are more at risk can go back to work. As testing supplies increase, we'll have other options that we can explore. But for now, we are making sure that the tests are available to those who need them the most.
Some kids are going to miss out on education if there's not enough leaders.
As I've said, where a school is disproportionately affected, then there are other options that we're working with schools to support, including the ability to learn from home. And we saw last year that actually schools can do that very well when they get the right support to do that. It's not the first option, it's not the first preference. Our first preference is to have kids in school. But where it has to happen, we can support schools to make that happen. I do want to note, though, that it wouldn't be fair to the teaching community not to acknowledge this, that blended learning learning, where they've got some kids in school and some kids learning from home, is a real challenge for schools. So we'll be supporting them as much as we can, but there is going to be a bit of bouncing around, and so we just all need to be resilient and adaptable, and I know that schools will do that well.
So how's the teaching community reacted to this? Have teachers indicated that they'd like to be able to do those reps, and then return straight away?
I haven't picked up a lot of interest in teachers who have someone in their household wanting to come back to work straight away. There is interest amongst the teaching community in having more ready access to tests, just because it gives people some reassurance. And I think everybody can understand that. I think everybody would like to have access to tests at the moment. We're not in a position to just make them available to everybody on an unlimited way at the moment. It may be that as supplies increase, that tests become more widely available. And I think that is likely in the next few weeks, but we're just not there right now.
What kind of class?
Sorry.
Why are we not following the FDA recommendation in other countries and boosting teenagers when so many schools are being?
Look, we've always worked on having our own technical experts give us advice around vaccination, around who should get them and when they should get them. That's the approach that we're going to continue to follow.
What kind of classrooms would qualify for an air cleaner? Could you kind of illustrate what schools would have to go through to get an air cleaner on site from them in the classroom?
So we've got at least 5,000 air cleaners that we know are going to be available by the time we hit that winter period where natural ventilation becomes more challenging. And we will be targeting those two areas where the ventilation might be poor, because they have windows and doors that can't open, because the CO2 monitors that we're giving highlight that there could be greater issues in particular spaces. So a lot of school spaces, they'll still be able to have a good degree of natural ventilation even in the winter. But there'll be some that's going to be more challenging for. So they'll be the priorities for the air cleaners. We'd also look at spaces where there's a higher risk. So for example, a school staff room where people might be removing their masks to eat and drink, and where you've got high concentrations of people who we can't afford to lose from the workforce all at once. Those might be priority spaces where we put air cleaners in. So it really is about making sure that we're using those in the best way possible.
So are the schools going to the Ministry of Education to seek those, or is the Ministry of Education actively looking at schools who don't have the likes of open windows?
It's a combination of both. So the ministry is just working very closely with schools, and it's a two-way relationship. Yeah. All right. Thanks, everybody.
Thank you.